Congressman Vince Fong, thank you so much for making time for us.
Thanks for having me.
So you and a group of House members sent a letter to Health and Human Services asking them to reject California's new MCO, Managed Care Organization plan changes, essentially. Just why did you do that?
Well, because Gavin Newsom is going to try to bail out or cover up his budget deficit by taking healthcare funds that was supposed to be dedicated to Medicaid in California. So that's terrible policy. It's something that we warned about when I was in the state legislature, that when you get revenue for Medicaid, it has to stay in Medicaid. It can't be swept into the general fund. And so that's the problem that currently exists, is that what the governor is proposing is to increase taxes, that one of the biggest taxes on Californians in our state's history. It's going to impact every healthcare plan, $400 per family, probably even higher. It's going to impact families, it's going to impact small businesses, it's going to impact local governments. All of that gets passed on, and all the while, it's just to cover up Gavin Newsom's fiscal responsibility. And that's why it should be rejected.
Okay, have you gotten a response from HHS, CMS, Robert F. Kennedy, Dr. Oz, anyone? Have they weighed in on this at all?
We haven't gotten a response yet. We've sent our letter in, but the frustrating thing about this is that the governor knows that his proposal is irresponsible. So he submits a proposal that violates Prop 35. He knows it. He submits a proposal that he knows he's going to basically rob to cover up a budget deficit, and it flies in the face against Prop 35. Prop 35 was passed by the voters, supported by healthcare organizations across the state, to ensure that this never happened, to ensure that the money that was received, if the federal government decided to provide resources to California, that it would go to increase reimbursement rates, it would stabilize the network of providers, it would ensure more access, reduce wait times. That's the reason why Prop 35 was put in place. The governor is ignoring Prop 35 with this proposal. And if you look at the solvency of Medicaid, if you look at the history of the governor's administration, Medicaid has expanded by over, has doubled. It was $93 billion that the state spent when the Governor Newsom entered into the governorship. It's now over $200 billion that the state's spending. All the expansions that have occurred has been irresponsible. And if you look historically in the past, Medicaid has borrowed billions of dollars to cover their expenses that they didn't have budgeted. So this is the reality that exists, and the governor is just basically realizing that he's got a mess, and he's just trying to figure out how to get money. And that's not why the MCO was created.
The governor and state lawmakers have basically said, essentially, we're raising this tax because there were changes made to federal rules under H.R. 1. You know, they're trying to prevent even deeper cuts in the healthcare space. What's your response to that?
Well, the state of California is going to spend a record amount on Medicaid this year. The state of California is going to get more money on Medicaid than they've ever had.
From the federal government?
From the federal government. And this was under OB3, the reconciliation package, the One Big Beautiful Bill. So again, this is Governor Newsom that's trying to, preserve his presidential ambitions. He knows that there's going to be a massive structural deficit. You've covered it, you've outlined it, the LEO has outlined it before. And so the governor is basically saying, look, we have a problem. The state of California is reliant on the MCO tax. We've become more reliant over time. If you look at the criticisms of Joe Biden and as well as President Trump, the state of California and other states have basically misused or become more reliant on the MCO as a way to fix their budget. And that's not why the MCO was created. The MCO was created to ensure that Medicaid systems and the Medicaid program in California and other states had resources to provide to the most vulnerable in our state.
You used to be the budget vice chair in the state assembly. I mean, how should have California leaders handled this? I mean, with the rule changes, should they have taken money from somewhere else? Should they have just made some bigger cuts? What should they have done?
Well, one, they can't sweep the money into the general fund. That is something that we warned about. I remember sitting in budget hearings asking the LAO as well as the Department of Finance, like, how are you allowed to do this? Look, I think there are structural reforms that have to happen under Medi-Cal. I think the waste, fraud, and abuse is real. You see this now. I mean, billions and billions of dollars have been identified, whether it's in hospice fraud or other fraudulent payments that have been made by the state of California. I think you have to stop the expansions. The healthcare proposals to give healthcare to undocumented and illegal immigrants is not the right approach. It's wrong. It's the wrong policy. If you pause that and reversed it, it would be significant savings. You have to look at the general fund to increase reimbursement rates across the board. How do you have a delivery system where you don't have doctors and hospitals that are going to participate in the system? So there has to be, and you need full transparency. That is the thing that I think is missing. When the state of California makes an error and says, oh, we're short $3, $4, $5 billion, and we have to borrow against the general fund, or we have to find a way to borrow and pay interest, there's something wrong with the process. So there has to be, I think, an audit of the Medicaid system in California to look at where you can find efficiencies, where you can find savings, and how you can increase the reimbursement rates responsibly to ensure that doctors and hospitals and providers have stability. It is interesting when you look at this proposal, every single healthcare organization in the state of California opposes what the governor's doing, from the hospitals to the doctors to the insurance plans. Everyone is opposed to this because they know it's going to make the affordability crisis worse, and it's going to only lead to a robbing of the MCO revenue to cover up fiscal irresponsibility.
Is there an ideal timeline to hear from HHS on this? I mean, just given that California leaders expect this to take effect January 1st of 2027. But if it's rejected, they need to go back to the drawing board. I mean, is there an ideal time frame in which HHS decides? Well,
there is revenue currently in place from the previous MCO that will provide resources to healthcare systems across the state. I think this is looking forward to try to figure out, what can be done in the future. I think that the state of California needs to look in the mirror and have a heart-to-heart with itself. When you have a state that is solely dependent on this, and you're misusing the resources that was outlined when the MCO was created, there's something wrong. And it's not just California. Other states have done it too, but other states are now pulling back the curtain and saying, look, we probably didn't use it right originally, and now we need to figure this out. California is just doubling down on the mistakes. And I think that's the most frustrating thing, is that now that I'm in Congress and looking at the budget and how the healthcare dollars are being allocated, California is going in the wrong direction, and they're not realizing that they're doing real damage, not only to working families and small businesses in our state, but they're also creating a process and a system that is going to make Medicaid, or Medi-Cal as we know it in California, more insolvent moving forward.
So, I mean, as a potential backup plan or alternative or another way to pay for this, California lawmakers and the governor put in motion this move to look at a potential free rider penalty, which some states call it, that would basically tax big corporations that have workers on Medi-Cal, Medicaid. Is just your reaction to that? Apparently the solutions are due by April 1st for the next governor of California, whoever that may be, but your reaction to that?
That's just doubling down on insanity. We have an affordability crisis in our state. The tax burden is enormous. People are leaving and businesses are leaving because they can't afford to stay here. And if you're going to if the Democrats are going to propose another tax, it's only going to exacerbate and worsen the problem. If you look at the state budget right now, California gets roughly, in a good economic year, up to 40% of their general fund from the most successful people and the most successful businesses in our state. So if the next governor or the Democrats in the state legislature here are going to propose another tax on business people or entrepreneurs or innovators in our state and push them out, you're going to have a bigger budget hole. You're going to have a larger structural deficit that you're going to have to fix. So the solution is to look at the Medicaid system right now. I would say pause the expansions, stop providing free health care to illegal immigrants. That would provide enormous savings. You go after the waste, fraud, and abuse, which is very real, Dr. Oz, if you look at his the fraud task force that he is working with the vice president on, I mean, you're looking at $1 billion, $2 billion, $3 billion of savings just in the hospice fraud situation. So there are enormous savings that can be done that way. You look at eligibility requirements. If someone who is getting Medicaid right now and they're not eligible to, or they should not receive it, they're taking resources. They are taking benefits and needed health care from someone who does need it. A pregnant mom, a disabled child, a family that is in a need of healthcare services. That's why this debate and this discussion about fraud is so important. Because if someone is not supposed to get resources, it's taking it from someone who is supposed to get those resources.
There are, right now, nearly 2 million undocumented people, though, on the state's Medi-Cal system from the expansions that you mentioned. What do those people do? And in the counties that they live in, what should they do? How do they pay for that?
How does California function and provide healthcare when there is no Medicaid system? If you're going to do these expansions and you do it irresponsibly, you're going to destroy the Medi-Cal system as we know it. How do you have a healthcare system when you have no emergency room, when you have no hospital, when you have no doctors that are going to provide healthcare to our communities, whether it's urban or rural? That is why this debate is so serious and why we can't allow the MCO revenue to be swept into the general fund and be stolen and robbed just to cover up fiscal responsibility. That's why this is so serious. Because if you go down the path right now, if you accept the status quo that Governor Newsom has created, you're basically going to ensure that the Medi-Cal system cannot cover their costs. The costs will explode exponentially, and there's not enough revenue there to cover it. And so what, is the state of California just going to continue to borrow against itself? Is it going to continue to raise taxes and drive people out of the state, creating less revenue to the state? And all the while, the state budget is going to implode. And that's what's going to happen if you stay the course that Gavin Newsom has created. And the reality is the affordability crisis gets worse. Gavin Newsom is fixing his problem by increasing taxes on the most vulnerable people in our state and on the businesses that we need to be successful.
Gavin Newsom only has 5 months left in office. The next governor could essentially have the option to turn some of this around. Is that?
He is going to leave his successor with a nightmare scenario that will only get worse. You've covered it, and we talked about this before we went on air. The budget situation in California is serious. It doesn't get the attention it deserves. It's probably not a sexy topic where people sit around the dinner table and say, talk about California's budget situation, but it's very real. And you talk about the MCO tax proposal. You talk about this wealth tax proposal that is being put on the November ballot, which is a double whammy. And then you talk about the fact that you've got additional taxes that were added in the state budget when it comes to software and other things. You talk about the overspending that the state of California currently cannot rein in. So all the while—
The debt to the federal government?
The debt to the federal government, the UI and unemployment debt that you've covered and have put a real focus on. The state of California owes $20 billion to the federal government on a loan that they took out under the pandemic. That money was stolen by international cartels. It went to prisoners in California. The state of California spends over $565 million just to service that debt. It doesn't even pay down the principal. And what does the governor do with a $60 billion windfall that materialized with the IPOs and the tax relief that was provided by the federal government? He does nothing. He does absolutely nothing. And so this is, as someone who's a Californian who wants the state to succeed, this is a very frustrating thing. So the MCO tax proposal is just the tip of the iceberg in terms of the real challenges the state of California has. And I hope that his successor, my hope is that Steve Hilton wins, and because he's the only person that's willing to confront these issues, make the tough decisions, and be the change agent that we need at this critical moment in our state. Because if we don't change direction, the state of California is in for a very rude awakening because of the irresponsibility of not only Governor Newsom, but his predecessors when it comes to Jerry Brown.
Is there anything else you think we should know about this MCO tax and this whole situation before we let you go?
Well, I mean, the cynical side of me is that this is just basically to cover up a budget deficit so that Gavin Newsom doesn't have a massive budget hole when he's running for president. But on a policy level, this is terrible policy to allow an MCO tax proposal to be proposed that essentially is going to be robbed so that the revenue can be swept into the general fund to cover a massive budget hole that was created by very bad and poor decisions by Governor Newsom. And so I hope that everyone who is watching understands that this MCO tax, while it sounds wonky and arcane, it affects everybody. Every single healthcare plan is going to see a tax increase, and it's going to impact families, it's going to impact businesses, it's going to impact local governments because they have to provide healthcare to their employees or to their children.
All right. Congressman Fong, we really appreciate your time.
Thanks for having me.